Hello friends, my name is Dr. Arpit Kalia and I welcome you all on my YouTube channel, Right Academy, the home of success. Right, so today we are going to talk about the very neglected topic in the UG days. Right, so we will talk about the parathyroid gland anatomy in this video, particularly about the surgical aspects of the anatomy. Right, so after that we are going to talk about the primary hyperparathyroidism, secondary hyperparathyroidism, and the tertiary hyperparathyroidism. Right, so one by one we are taking this topic of the parathyroid gland, right? So let's move forward towards the parathyroid anatomy, right? So now we are going to talk about the parathyroid gland anatomy. So as you know, we have two pairs of the parathyroid gland, which is right superior and right inferior parathyroid gland, and left superior and left inferior parathyroid gland. So before going in depth of the anatomy, let's learn about the embryology of the parathyroid gland, which is very important in identifying the ectopic locations of the parathyroid gland, right? So as you know, we have pharyngeal arches and pharyngeal pouches. So this is pharyngeal arches, this is pharyngeal arches, yes, and this is pouches. So the parathyroid gland arises from the pharyngeal pouches, right? So the superior parathyroid gland arises from fourth pharyngeal pouch, right? And that is too from the dorsal portion of fourth pharyngeal pouch, right? This is your AIMS INICET exam question, right? Dorsal portion of the fourth pharyngeal pouch, right? So this is not ventral portion, this is the dorsal portion of the fourth pharyngeal pouch. And as we talk about the inferior parathyroid gland, right? Inferior parathyroid gland, so which is arises from the third pharyngeal pouch, right? Third pharyngeal pouch, from which the inferior parathyroid gland arises, and that is too from the dorsal portion of the third pouch, right? So what is arises from the ventral portion of the third pouch, right? From ventral portion of third pouch, what arises is thymus gland, right? Thymus gland, which is gland situated, the immunological gland situated, immunological gland situated in anterior mediastinum, right? So this is immunological gland situated in the anterior mediastinum. So up till now we have learned about the embryology of the parathyroid gland. So as we know, the superior parathyroid gland arises from the fourth pharyngeal pouch, that is to dorsal portion of the fourth pharyngeal pouch, and the inferior parathyroid gland arises from the third pharyngeal pouch, that is dorsal portion of the third pharyngeal pouch. And from the ventral portion of the third pharyngeal pouch, we have a thymus gland arises from the ventral portion of the third pharyngeal pouch, right? Ventral portion of the third pharyngeal pouch, we have thymus gland is arises, right? So as you know, the inferior parathyroid and the thymus arises from the fourth pharyngeal pouch. Actually, as per the normal descent, the inferior parathyroid and thymus should arises from the third pharyngeal pouch, right? But it is arising from the fourth pharyngeal pouch, right? So it's my mistake. So inferior parathyroid and thymus is arising from the third pharyngeal pouch. So there is a, as you see, there is a longer path of descent, right? As you see, there is a longer path of descent of the inferior parathyroid, longer path of descent of inferior parathyroid gland. So that's why inferior parathyroid prone to be more ectopic. So what is the location of the ectopic parathyroid, right? So we have to know, as inferior parathyroid and thymus both arises from the third pharyngeal pouch. So most common location of the ectopic location of the inferior parathyroid is also the thymus, right? As per the Sabitson 21st edition, thymus is the most common ectopic location of the inferior parathyroid gland, followed by the mediastinum, followed by intrathyroidal. The parathyroid gland is situated inside the thyroid gland, right? This is followed by the carotid sheath, right? So this are the ectopic location of the inferior parathyroid gland. So as you see here, the thymus is most common ectopic location for the inferior parathyroid gland. As you know, the thymus and the inferior parathyroid gland is arising from the third pharyngeal pouch. The dorsal portion gave rise to the inferior parathyroid gland and ventral portion gave rise to the thymus gland, right? So due to their longer path of descent, the inferior parathyroid is more prone to be ectopic, right? So that's why, as you see here, due to the longer path of descent, inferior parathyroid gland is prone to be ectopic, right? So is there any chances of the superior parathyroid gland which can be ectopic? Yes, the superior parathyroid PT can also be ectopic, but chances are less chances of ectopic location. Why? Because it is arising from the most constant, is it had to ascend upwards, not descend downwards, right? So as you know, अगर हमको पहाड़ पे चढ़ना होता है तो हमको चढ़ने में ज़्यादा दिक्कत होती है, इसके मुकाबले उतरने में कम दिक्कत होती है, राइट? इसीलिए यहाँ पे the superior parathyroid have to ascend from this embryological origin, so that's why it is less common ectopic in nature, right? So if it is ectopic, what is the ectopic location of the superior parathyroid gland? ये ऊपर की तरफ ectopic नहीं होगी, ये ectopic होगी posterior mediastinum में, right? posterior mediastinum, retroesophageal, tracheo-esophageal groove. So these are the ectopic locations of the superior parathyroid gland if it is ectopic in nature, which is very rare for the superior parathyroid gland, right? So this is all about the embryology of the parathyroid gland. So as we see, the parathyroid gland are brown to yellow or mahogany color, right? Situated behind the thyroid gland in close proximity to cricothyroid junction, right? Located in close proximity to the cricothyroid junction, right? So this is about the it is a 20 to 40 gram gland, right? 4 in number. Inferior PT is more prone to ectopic, right? So what is the blood supply? Blood supply, as you know, the blood supply of parathyroid gland is 80% of the blood supply from inferior thyroid artery, and the 20% cases it is from the superior thyroid artery, right? So this is all about the basic anatomy which you have to know for your exams for the parathyroid gland. So if we can say about the location of the parathyroid gland in relation to the recurrent laryngeal nerve, so Bailey and Sabitson both says the parathyroid gland is located in area 2 centimeter in diameter from junction of inferior thyroid artery and recurrent laryngeal nerve. So what does it mean? Suppose this is the inferior thyroid artery and this is recurrent laryngeal nerve. So this is the junction of these two, one nerve and one artery. So the area 2 centimeter in diameter, it is 1 centimeter radius, right? And this is 2 centimeter in diameter. This gland is situated in this 2 centimeter of diameter of the junction of the recurrent laryngeal nerve and inferior thyroid artery. If you go from the Bailey nerve, the superior parathyroid gland situated, the superior parathyroid gland is situated posterior superior or dorsal to RLN, and inferior parathyroid is situated antero-inferior or ventral to RLN. So as you know, suppose this is the thyroid lobe, right? This is the thyroid lobe, and this is the recurrent laryngeal nerve. So this is a posterior superior. Here is your superior parathyroid gland, and this is antero inferior. Here your inferior parathyroid gland is situated, or ventral to the anterior, or ventral to the recurrent laryngeal nerve is inferior, and dorsal or posterior superior to the recurrent laryngeal nerve is your superior parathyroid gland, right? So this is all about the anatomy of the parathyroid gland, which you have to know. So I have downloaded this one image which tells you about the Behr's triangle. Yes, Behr's triangle, which boundary is formed by the Behr's triangle, is inferior thyroid artery. This is recurrent laryngeal nerve, and this is common carotid artery. So this is the most common location where the recurrent laryngeal nerve injury occurs, right? Or this is the location of the parathyroid gland also, right? This is the location of the parathyroid gland just behind the thyroid gland. This is called Behr's triangle, right? Say other triangle is also given, this triangle of concern, Simon's triangle. This is all related to the recurrent laryngeal nerve injury. And if we talk about the external laryngeal nerve injury, so this is Cernia classification, and the Joll's triangle is associated with ELN, external laryngeal nerve. And the simple dictum during thyroid surgery to prevent the neurological injury is remain as close to the gland. Remain as close to the gland during surgery, right? If we talk about the external laryngeal nerve, so this is your thyroid, right? Your thyroid lobe, and this is your superior thyroid pedicle, right? And this is your external laryngeal nerve. So the relation of the external laryngeal nerve with superior thyroid pedicle is divided by a Cernia classification into the three part. That is Cernia. It's Cernia classification, right? Which talk about the type 1. One is the distance between the ELN and ST pedicle is more than 1 centimeter. You know, this is talking about this distance, right? This is more than 1 centimeter. Type 2A, it's type 2A is distance is less than 1 centimeter, or nerve is above the gland, above the pedicle. Or type 2B, don't make mistake here, it's type 2B, not type 3, right? It's type 2B. Many students making mistake there. So its nerve is below the gland. So this is all about the parathyroid gland anatomy, which you have to know. So let's talk in brief about the physiology of the parathyroid gland. So what is the role of parathyroid gland? The role of the parathyroid gland is to maintain your blood calcium level. So as your plasma calcium level decreases, yes, as your plasma calcium level decreases, it gives a stimulus to the parathyroid gland to secrete more parathyroid hormone, and which in turn act on the kidney to reabsorb calcium more and inhibit the phosphate reabsorption. It increases the calcium reabsorption from the kidney and increases the bone resorption. It has catabolic effects. It is seen that catabolic effect on cancellous bone and anabolic effect on trabecular bone, right? So this is action on the bone. So cancellous bone, what are the cancellous bone? The distal end of the radius, distal end of radius is cancellous bone, which is other neck of femur. These all are the action of the parathyroid hormone on the kidney and bone. On intestine, parathyroid not act directly, it acts indirectly via the activating the vitamin D in kidney, which in turn act on the intestine to increase the calcium reabsorption by the help of the 1,2,5 dihydroxycholecalciferol, right? So this is given here. So this is all about the parathyroid gland anatomy and physiology, which you have to know for your exams, that is NEET PG and INI SAT and NEET SS exams, right? So that's all you have to know.